Okay, hi, and welcome to the Get Healthcare podcast. My name is Dylan. Today I'm joined by Dr. Hamison. Today we're going to run through some of the elements, I suppose, a quick chat on the differences between online and in-person medical care. We are launching a clinic in Gorey with Dr. Hamison today, so I think it would be an appropriate uh, subject to look at. Thanks for joining us, Dr. Hamison.
Yeah, hi, Dr. Hanisyam here. Thank you for having me.
Okay, very good. So just the first question, how do the diagnostics accuracy and treatment outcomes compare between online telemedicine and traditional in-person care?
Yeah, of course there will be a difference. Face-to-face tradition, face-to-face medicine much more accurate. But we can do examinations. But with online telemedicines, the good thing is we can be anywhere. The patient can be anywhere they want. Yeah. So and then even in the house, in the workplace, you can you can see a doctor as fast as possible, as convenient as possible as they can. Yeah. There will be limitation, of course, on telemedicine, but however, we can provide something like very fast medicines consultations to the patient, to the clients. And yeah.
Very good. So what are the main challenges doctors face in building patient trust and rapport during virtual consultations versus in-person visits?
Yeah, of course. As a doctor in telemedicine, we are not their own GP. So initially, of course, they will have some kind of trust issues initially. But as any doctors, we try to get as much information from the patients, trying to get so that we can get a correct diagnosis, so that we can try to give the best possible diagnosis, but possible medication to the patient, and hopefully they are feel the trust we're building will be built from there, and then initially we become a trust platform then.
And how do you determine which medical conditions are best suited for online care versus those requiring in-person examinations or in-person testing?
That is very good question, actually, Dylan. For of course the telemedicine, we try to give, but mostly of the people who are sick, who needs help. They are minor cases, minors. For example, common flu, common cold, muscle sprain. So nothing major. So that the best platform to be used for telemedicine. However, is a patient who has very chronic, very long-term problems of the sick, so expected to go see face to face, so that we can order some further investigations, so that and also we can know what kind of specific medication needs for them, specific treatment, the best treatment possibly to be given to them.
Okay, very good, very good. So more minor illnesses essentially online, and anything that
Yeah.
would be long-term or major, we're looking at in person.
Exactly.
And
Yeah.
hopefully now we'll scale and be able to service both in person and online. Okay, thanks so much for joining us today, Doctor. If anyone has any questions, please feel free to pop them in. We'll try to cover one subject every week. And that's it. Thank you so much.
Thank you. Thank you for having me.